thanks so much. We are going to go ahead and get started. If you're okay, I'm going to introduce you.
Thank you very much. Yes.
All right. So this is very exciting for us to begin our partner conversations with your talk. They are the backbone of the course. And one of the nice things that came out of the pandemic was the increasing use of virtual platforms like Zoom and the ability to bring our partners closer, even if we're not able to travel. So this is a super exciting piece of the course, and I'm glad to see so many students in the room today. So Dr. Iván Palacios is joining us from the Universidad de San Francisco de Quito in Ecuador. He obtained a Doctor of Medicine degree from the Universidad Central de Ecuador, del Ecuador. He has a master's degree in public administration with a focus on health administration from the University of New Mexico. He's a professor at the College of Health Sciences in the area of prevention and health promotion. And he also leads a successful community engagement program and serves as the director of the Global Health Program at the School of Medicine at the Universidad de San Francisco de Quito. With over 30 years of experience, he has expertise in designing, implementing, and supervising public health, global health, and social development projects. His specialties include health management, advocacy, strategic planning, sexual and reproductive health, and community participation. He's collaborated with bilateral and multilateral donors such as USAID, Inter-American Development Bank, World Bank, and European Union. And I just wanted to make a shout out as well that we had our first group of fourth year medical students participating in a clinical rotation at a community clinic last year under the mentorship of Dr. Palacio and working with his colleagues in Quito. And so we are super, super lucky to have him speaking with us today. Thank you so much for being here, Dr. Palacios.
Thank you very much, Tracy. Thanks for your kind words. And it's an honor to me to participate in this conversation with your students. And I hope this helps to understand our program and also help us to enhance our partnership. That's what we are looking for. And we had a very good first experience and expecting to have a new group of students that are coming along and advance in this partnership. So thanks for this opportunity. So if I can share my screen, I would like to start. Here we go. Can you see my screen?
Not yet. Oh, there it is.
Okay. Seems like there you go.
We can see it now, Dr. Palacios.
Perfect.
Thank you. So this is Quito for those who hasn't visited our country yet. It's a beautiful city located up in the mountains. This is a picture of the main square. You can tell the presidential palace is it's where the flag is showing. And today I would like to address some the following points, basically to talk about the program objectives related the program that managed.
I won't come back. There is a limit.
You can't live without me. What the hell is you?
If any students, sorry, Dr. Palacios, let me just interrupt. If any students have their microphones on, can you please mute it? Thank you. Go ahead, Dr. Palacios.
Thank you. So I'm going to be also introducing the program components, some of the projects that we are implementing as part of the School of Medicine with our students and our partner from the Ministry of Health, and then open the floor for questions and answers. I'm expecting 35 minutes talking, and if you want to make any question or comment before, you can go ahead. So the general objective of our program, this is a program that is being implemented as a teaching activity, but also community engagement, and also we do some research. So the general objective of our program is to contribute to improving the quality of life, quality of health of the 16 rural communities that we work with, that we serve as part of the program. And the specific objectives in terms of teaching objectives is strengthening the students' knowledge of the concepts, principles, methodologies, and approaches to health promotion and prevention, applying them practically through the implementation of various projects and activities. What we wanted to do is not just to teach, in a classroom and talk about examples or do workshops or whatever you want to do. Basically, it's combine the theoretical component with the practicum that the students are having in the where we work. So our approach basically has three components. One is teaching. That component, I do the teaching activity in classroom. The second has the community outreach, the community engagement. And the third component is research. As I said before, the academic components are basically prevention, promotion, and basically the backbone of these components is the social determinants of health, how those are affecting the health of the communities and how, in practice we can learn and try to make some changes. And we are working following the life cycle. So students learn about health prevention and promotion on child health, adolescent health, maternal health, adult health, and elderly health as well. And these are the communities where we are working. If you're asking what is USFQ, USFQ is located near Cumbaya, where you can see this spot. And there are 16 communities. The one that is located far away is the Amaguaña. You go by car, it's more than an hour from Cumbaya campus. And sometimes the students doesn't have a car and they go along, they have to ride a bus. That's how they commute from home to the clinics. And they devote one day from 8 a.m. to 4:30 p.m. one day a week during 2 semesters. That's what they do. So they start implementing different activities related with the syllabus that we have developed. And this is very interesting component because when I joined the school, I was teaching the same class, but I think it was the most boring class I ever taught because it was basically discussing about different concepts, workshops, and this type of lectures, but nothing in practical. And we were able to have a pilot experience where students came back from the field and they loved this experience. And that was an interesting experience because they gave a very good feedback. And I told them, well, I have no power to change. They wanted to have a large practical experience. And I say, why don't you go and work and talk to the dean? And at the time we have Michelle Brunauer, our dean, and she was very open-minded. And she said, why not? So thanks to her openness, we were able to advance and implement this program. And what we do is prior to the beginning of the field activities, the students receive an induction and training plan. Of course, we are requiring they have approved the bioethics component because they must learn before go to the communities, to clinics, all the bioethics components, and they do that. And it's interesting because when we have the induction activity, we ask them, do you remember who talked about this and what do they say? And the idea is this is the opportunity for you to practice, to put in practice all the components related with the ethics and all of that. Of course, Ministry of Health required for every single health staff, including students, to be vaccinated, to have the full package of vaccines, including COVID and other vaccines. And we provide training on key components. As in this picture, one of our partner organization health worker is training about how to do eye screening, how to use the Snellen scale to measure, the health eye of children. And so during this semester actually is going to happen at the end of October and during the whole November. That's what they do. So they are trained on how to take a blood pressure, how to do, all of the basics, measurements, temperature, and so on and so forth. And the idea is just should also be humble to learn what typically, a nurse is doing. And the idea is they are humble, they understand, they are part of a team, and they have to understand all the basics related with the medical service provision. And that's what I like it, when I was talking with somebody and she was saying that she was taking more than an hour commuting from home by a bus, by public transportation. And I was asking her how many times before, you use public transportation. She was saying, I never, because I was using the bus transportation or my parents, commuted me. And I was saying, and what is your experience? What do you think about that? And they say, well, I never thought, how people use public transportation and all of that. So that's probably part of the hidden, syllabus objectives of this program. It's not just technical skills, which is very important, and we are very strict on that particular topic. But going is beyond that, and we want to change the health status of the community. The best way to do so is by learning what is actually happening, how communities are living, how do they commute, how, and so on and so forth. So we don't want they to receive a story about the challenges that people, especially poor in the rural areas, are suffering. But the idea of the program is that they go and they realize and understand what is part of that. And the idea is also students are members of a team, but they are not doing shadowing. This is not the purpose of this program. And we have been able to have an agreement with the Ministry of Health where our students can do this type of rotation. And we have selected in each of the clinics one tutor that is being trained and is part of the program. And this person is responsible for making sure the activities that the students has to comply during their rotation has been properly implemented, not only in terms of numbers, like they have to conduct at least 3 pap smears. So we provide all the supplies, we train them, and under the supervision of the OBGYN or of the physician, they conduct the pap smear. But not only the component, the technical component, but also how they approach patients, how they address with people, how they talk to people and interact with them. The idea is this is a relationship where we want to enhance the communication skills and the empathy component of this. So this is part. And the other component is the idea is they should become at least members of the community. As in this group, this is a beautiful picture of the Elderly Club we helped to create back in 2015. And the idea is they interact with the community and are part of the community and try to work together with them, improving their health. So when we talk about aging and we talk about ageism, and we want to prevent it, probably the best way is by putting the students early in their training and the education process in contact with the communities. So they become friends and they like how they are interacting and part of the program. So under this approach, we have some projects that are trying to, first of all, understand what are the issues related with the health in terms of child health, which I'm going to start introducing. One of the biggest issues is stunting, malnutrition. Around 20% of the population is suffering from this. And in the region, only Peru has successfully implemented a very interesting program. So I was reading a lecture of the year experience. So we want students to engage in this type of discussions. And sometimes, well, since you are a medical student, you want to be trained doing some medical activities, and we one day go beyond that and try to work with the communities, understand how the access to water and sanitation, or the importance of breastfeeding, or the importance of vaccines, and so on and so forth, are very important. And they understand that they need to interact with the communities, with parents, with other community leaders, and so on and so forth. Now, during this semester, students has also to work providing vaccines, at least 20 vaccines they have to provide to children. Many times those numbers go up. And talk about nutrition, understand how development of children is happening, the importance of doing measurements and helping in the clinic to promote the importance of the first year medical control on a monthly basis, promoting breastfeeding, what are the challenges they face, egg and fish consumption as part of the studies conducted by the university. One of the faculty of the Palacios school identified the importance of the egg consumption early in the childhood, preventing malnutrition, and it's very cheap and affordable for the community. So students learn and are advancing on that particular component. The other is HPV. Our students also are part of the campaign. The Ministry of Health now, since a year ago, are vaccinating not only girls, also with boys. And they are also part of the program, educating and working on those components. And since 2017, in a pilot project that is trying to prevent obesity and overweight. And 2 years ago, we began a research with Washington St. Louis University, research where we would like to explore how an intervention can prevent overweight and obesity. We are in the final phase of that research. I'm visiting on November a conference where we are going to present these results, but the students are part of the educational component and part of this research. And changing of group adolescent health is really, very important. Also, we were discussing yesterday with some of our students about adolescent health, and 20% of the population it's on that age, and around 19% of girls from 15 to 19 years old have experienced pregnancy. So one of the challenges we have been trying to address is how to prevent unwanted pregnancy among adolescents. And during the last 5 years, we were able to design a pilot experience in Cotacachi, a rural community, where we've been addressing these topics related with girls' empowerment and pregnancy prevention and so on. And we were able to work developing a platform, an educational platform, that it helps to provide online training on topics related with sexual and reproductive health. The platform is using UN, UNICEF guidelines in terms of those particular topics. And we were able to test the first 2 years in experience with Minnesota University. And that was a very interesting experience. The project, we thought that developing online training materials can be used by adolescents And when we measure the baseline and the outcome, we didn't succeed it. And what we learned is, unfortunately, that, assumption that the, adolescent population can by themselves and, enter to this type of platforms and follow all the lectures we have developed, not always happen. They get bored. They identify that one of the videos, for instance, used to last around 8 minutes. So when we developed that was back in 2020. And when we tested this program, already TikTok was launched. So 7 or 8 minutes in the era of TikTok was kind of soap opera. They got really bored. They wanted to have something 30 minutes long and all of that. So it was a good experience because we were able to redesign this platform with this group of indigenous population, and it's interesting because this platform was designed with one of our alumni. She was doing her last in 4th year of med school last year in Ecuador. It's 5 years. She was doing her internship and she went to Cotacache during the pandemic, and we discussed about why don't we take advantage of this opportunity and test during the era of Zoom if adolescents can be, addressed by using this type of methodology. So finally, we have been able to launch a year ago, and we are in the implementation stage, scaling up and replicating this platform. And with Brown University a year ago, we were able to work in the same area with Cotacache, and where we incorporated a syllabus related with financial empowerment. And the outcomes of that experience is very interesting. It's very positive, and we would like to scale up and replicate. So this is related with maternal health indicators. We have one of the students of 3rd year learning how to do measurements when a pregnant woman is coming to the clinic, and we want to contribute to reduce the maternal mortality and enhance the prenatal care access to services. So students, as in this picture, are doing home visits to identify pregnant women and invite them to be part of the program. Led by the Ministry of Health, of course, promote prenatal care, teach about risk signs and nutrition during pregnancy, HIV/AIDS, vertical transmission prevention, vaccine, pap smears, and so on and so forth. Here we have a picture of one of our students. This is in Antingo, where I think Elizabeth is the student from UCLA that came last year. And in El Tingo, we have this club of pregnant women, and they are receiving a certificate and also having a baby shower activity. They are about to deliver. So they have complied all the educational and prenatal care, controls and checkups, and the students are very, engaged in this type of activities. Diabetics and hypertension. It's also another topic that we are working, and I think if you ask me in which area do I feel that we need to work more, it's probably this. Chronic non-communicable diseases are becoming a more and more public health problem for Ecuador, and unfortunately, the Ministry of Health has been, the 51st years of the existence of the Ministry of Health, they were devoted for maternal and child health. And they did it well. Maternal and child health mortality, morbidity has been improved a lot. And of course, there is a space to improve as well. But now they are starting to see chronic non-communicable diseases such as hypertension and diabetics and so on and so forth. And they don't have either the skills or the equipment and supplies needed to advance on this. And And for instance, when we talk about diabetics, there is no an educational plan designed to be implemented for patients and that help them to advance on the management of these issues, you know. Of course, we are also helping to do some screening, trying to identify people at home doing home visits to see if they have diabetics or have hypertension or other activities. And we have been able to also work at the community level, creating a club of patients to enhance the management of nutrition, of add-ons to treatment, and so on and so forth. Now I'm changing of the group, and this is one of the groups that really likes to work. I've been working for more than 10 years on aging, trying to advance on healthy aging. One of the reasons is because we are becoming an aging community, and last census is saying 12.5, around 2 million people, from 1.5 to 2 million people out of 18 million people are elder, above 65 years old. And again, the Ministry of Health more and more is being demanded to provide services for them. And the Ministry of Health doesn't have a program that it provides services in terms of medical attention or promotion, prevention. And what we wanted to do is to create a demonstration model about how to manage this type of topics from the service provision, but also from health prevention and promotion. We have been able to create these elderly clubs where, for instance, in this picture, they meet a couple of weeks in PIFO, they do biotherapy, they do celebrate birthdays and Christmas parties, and all of these type of activities, because we understand the importance of socialization. So we are basically trying to go outside of the box, try to keep them healthy in order for the service to protect them. And we are started working this year with two different faculty. One is the School of Arts. They are becoming part of the program. And the idea is they will teach about, how to paint, these type of things. And the other is the marketing component, the School of Marketing. One of the faculties learn about the program, and I invited them. So they are going to be working, trying to see if we can create a blue community where aging is the center for everybody, and working with the market, with the, private little stores in this little town, and with the local government to sensibilize about the importance of working with the elderly and advancing on this approach. The students also are trying to do some home visits, helping the clinics to identify elderly population and invite them to be part of the program, and also providing some service provision. So this is something that really needs to be enhanced. We have designed a pilot project, and we are about to launch with one elderly hospital located in Quito. We want to create a telehealth program where our interns that are doing the rotation in 3 clinics are going once a week to the hospital to receive training, but also to work designing the referral and contra-referral telehealth program. And the idea is to use by the Ministry of Health and see how that works. That's what we are doing right now. So now I would like to invite the students to think about, and also the faculty that is joining us, how can community outreach transform medical students' attitudes? That's something we were asking. Are we actually getting something beyond the technical skills that we want them to achieve, or not? And I think, based on the evaluations on the focus groups that we have conducted, we have been able to identify some elements that are part of the program. One is increased empathy and compassion. Many of the students never thought, and that was the reason of the beginning of this program. One of the students came and he was basically, very touched by the experience he had in El Quinche with an elderly person. He said, I never thought people lived under this type of conditions. I never thought this is happening, and this is happening 30 minutes from here. And this is the person who said, why don't we go at least one day at the community to work with them? And that was the beginning of the program. Say, yeah, I like you being touched. Let's do it. And that's how we start designing. So it helps a lot to live the reality of patients and to develop a deeper sense of empathy and responsibility. Many of the students are coming with different ideas and different projects. They say, after this visit, I would like to do something else. So we ask them, what do you want? And why don't we start discussing? And why don't you begin creating something? This is a picture of the students from Cotacachi, where we work. And this is another component, cultural competence. It's very difficult. How to be humble with people from rural communities, indigenous communities, and understand that they probably have a different perspective, point of view about health, and how to not impose what we learn, but try to be part of the community and work together with them. And I think this is not something you teach in a classroom, unfortunately. At least that's my experience. I think that's the only way. You go and you start understanding and trying to advance in terms of communication. And it's not only language, but it goes beyond that, as you probably. The other component is strengthening professional identity. This is a picture of one of the programs we began implementing 3 years ago. It was Agustin Pozo, a last year student, who came to me on February and said, Iván, I just beginning, this is the last year, a pre-rural service training. That's how they call it in Spanish, pre-rural. And it's 12 weeks rotation. And I'd like to see if we can operate some people from some skin problems. And I said to him, Agustin, is very interesting idea, interesting project. But how does this connect with the public health? Don't forget, this is a public health rotation. And so I asked one of my colleagues, it's a dermatologist, and I say, this is what he would like to do. His father is a plastic surgeon, he wants to become a plastic surgeon as well. Say, man, why don't we work on skin cancer prevention and work with them? This is something that is being neglected. So we created this program. And it's very interesting, thanks to somebody who was touched and interested in this particular area, we were able to create this program. It's 3 years old, this program. More than 300 people has been attended. Out of 75 patients has been identified with skin cancer, vasocellular or squamous cellular, and few of them melanoma, and they receive treatment. The program that we were able to create is that they receive treatment in a primary health care clinic. So the pictures that I'm showing belongs to one of the patients. And the left up, it's how he began with the lesion. It's not clear. Then we develop on Tuesday, they have a dermatologist that is coming to the clinic to provide services, but it's an educational program. The interns should present the case and discuss the case, see what is the diagnosis and come up with solution. And the third picture is the dermatoscopy, and we provide a dermatoscope and iPad for the program. The first picture on the left and down is the results of biopsy. The medium is 2 weeks after the surgery, and the last is how he is now. Going back to Agustin, it's interesting because he went to the States and is in the States right now. He said one time, he sent me a letter saying, Ivan, an email, a WhatsApp message saying, I would like you to help me with a letter of recommendation. And I say, yeah, of course. What are you doing? Where are you applying? He said, I'm taking my master's degree in public health. And I say, Agustin, did you change your mind? He said, no, I'm going to be first public health, and then I'm going to study plastic surgery. And I want to apply with more global and social component. And I think this is the outcome of one of the outcomes that we are looking. So students understand and go beyond and challenge ourselves to advance on that. The other is enhancing the capacity and adaptability to adapt responses to this context. We have students in Pueblo where the clinic in skin cancer is working, and this is the picture where Tracy and the group of UCLA visited in Pueblo, and some of the students and one of our partner organizations that we work with. The other is probably the other outcome is building community commitment to service and advocacy. You know, they realize that they need to do some changes. And this is a picture of one of our students doing a visit on a farm where a flower company is working, and we conducted a HPV self-sampling research, and we learned that the acceptability was very high for women and also for providers in terms of self-sampling on HPV, and students were engaged in part of that research. So I'm going to stop here. Probably some research projects, the names, and that's not relevant, but probably we are addressing these programs are very linked with the Objetivos de Desarrollo Sostenible, Sustainable Development Goals. Sorry. And at the end of the rotation, students receive a certificate for the hours they committed to work with the communities. So I would like to thank for your attention and open the floor for comment, questions, clarifications.
So to the students, feel free to raise your hand to ask question and be called on, or you can put it in the chat as well. I have a question to get us started while the students are thinking of questions that they might have. But I'm curious, is this public health rotation required for all medical students at USFQ, or is it, do they opt in to it?
Is part of the syllabus is required. So those are, as I said before, it was a theoretical component, and we design the practicum as part of this. It's required. It's part of the training, especially for the last year students. It's 12 weeks rotation. It is mandatory they comply with that. That rotation is supposed to be in preparation for the social service year that is called a rural year, where in Ecuador, it's mandatory to comply working 1 year in a rural community, providing services in a facility of the Ministry of Health prior for you to start working or doing your residency in Ecuador.
Thank you so much for that. This is a shy group, but I'm actually not too uncomfortable with long silences, so we're gonna we're gonna wait for those questions.
One of the questions I have is based on this experience, the students, for anyone, what do you think UCLA students can do or engage with, or would you like to be part of? How different is the context that I presented to the experience you have received in LA? Probably it's a huge.
That would be a great question for one of our third year students, I think, who have been in the, been in medical school for a while. This is mostly like 95% of the people in the room are first year, so they haven't actually had a ton of exposure yet, but we do have a couple of third years that maybe they can talk about if they've had similar opportunities for rotations where they're able to engage more with the community.
I can take that question. So, in terms of community engagement, some of our sites definitely have different focuses. So, if you're at the main UCLA hospital at Reagan, that's going to be more of an urban population. But if you go do an away rotation, or not away rotation, if you get selected to go to Bakersfield, which is a more rural location, you're going to be a little more, have a little more of a community-driven focus. But we don't necessarily like go out into the community and practice in like non like healthcare settings themselves during the second year. Does that make sense?
Thank you. Yeah, a lot. I see somebody is asking about what social cultural barriers and perhaps stigmas you had navigate when designing contraceptive educational trainings. Yeah, it's a big challenge. You know, we are a very Catholic community where the Catholic Church has a big influence. But in Cotacachi, let me tell you one of the experiences when we were presenting the platform, I met with parents and we talked about the importance and what are the components of the platform. And it was a research. We wanted to ask them to sign the consent form for their children. So in order to have the consent form, we had to present all the platform and the components. And at the end of that, I asked for comments or questions of the platform. And one lady raised her hand and she said, finally, somebody is doing something. There is a lot of adolescents and girls pregnant and nobody's doing nothing. And I think this is the moment to start doing something. And I think that something shows that many parents are looking for ways and mechanisms to advance on teenager pregnancy prevention. And they, just because the cultural background and Catholic background, sex education or sex conversation with the children, it's a taboo. And I think this platform opened the door to work with them. If you're asking me, what do we need to work with, as working with a component for parents' education on sex education, how to address these topics with the adolescent population. Unfortunately, we didn't have the resources to work on that particular component. So there's a huge need and probably demand, you know.
Another question in the chat. I'm happy to read it if you'd like.
Yeah, please.
Yeah, so for the skin cancer program, how was the implementation structured? Was there a component of self-screening education in the community, or did the 300 participants present to the clinic and then were screened?
Thank you. Actually, students did, at the beginning, we began doing a community screening. And that was the beginning, we began working with one clinic in Pueblo. And every intern that arrived was trained about conducting this type of screening. And we we're working with the elderly clubs or chronic non-communicable groups of patients, and that's how we target them. So the students were trained and they conducted the screening, and we were able to identify. And then we thought we were only benefiting one community, and we designed the program to train all the students that are going to the different clinics, the last year students, to conduct the same type of screening. And they have a standardized mechanism where they are identifying patients and trying to identify as early as possible. And it's interesting, if we would ask to go through the system using the referral mechanism that exists, it takes more than a year to get an appointment with a dermatologist, not to be operated as we had done it, within a couple of months, the whole cycle. So that's how we are working, and it's an educational program. The idea is the dermatologist is not there to treat patients, but to train the family medicine practitioners and our students and work together, enhancing the capacity of the clinic to continue after we leave, because we are planning to end this experience in 10 months and move to a different clinic to work with another family medicine practitioner.
Any other questions for Dr. Palacios? It's a great opportunity to chat, and also for those that are considering a fourth year, 3-week clinical rotation. The students this past year, as I mentioned at the beginning of the call, were in one of these community clinics. They were working alongside the tutor and the other medical students and the team providing care. They were part of the home visits. I see a question came up here. So outside of the prevention education platform for sexual health, what does public health messaging look like in Quito? Oh, you're on mute, Dr. Palacios.
Well, it's interesting. Thanks for the question. The Ministry of Health has moved from the two opposite, typical perspective from pro-life and pro-choice. And now we are dealing with some kind of pro-life, but the messaging in Quito is that adolescents should have access to contraceptives and all of that. From the other end, especially from the pediatric perspective, they are very concerned about the number of children that are in Ecuador. 4 years ago, around 400,000 children born during that year. And last year, it was 160,000. And so the numbers were dropping down. And that is basically what happened when the community is aging. That is the trend you can see. So people are saying maybe we should start promoting or stopping to promote family planning services and contraceptive use, and the importance of having babies. That's kind of the discussion that we are facing lately. And we were saying maybe I would address the issue of the number of babies in a different way. Say, well, this is an opportunity for us to stop stunting, improve education, and work on aging, components, if you're asking me from a public health perspective.
Dr. Palacios, if a student wanted to get involved with some of the work you're doing, supporting it, not necessarily with being, there physically in Quito, but supporting from here at UCLA in some way. Are there ways for students to get involved? We have students that are participating in a concentration where they can work, kind of on a small, distinct global health project while they're in medical school. And then we have students that are participating in a discovery year where they have a little bit more time to devote to the project and can travel in country to support. Could you provide, a small example of how a UCLA student could maybe get involved with some of the great work you're doing there?
Thank you. Yes, the answer is yes. As I said, in terms of chronic non-communicable diseases, we are looking for designing a good, program, and maybe that's something you can do together via online with our students and somebody from our team to be working together in terms of designing something and then probably testing, piloting how that works, and then presenting that experience. So that's something in terms of different opportunities that we are trying to create. So the programs that exist offer a lot of opportunities to advance. In terms of skin cancer, as I said, also we are designing a telehealth program where also the idea is to show the Ministry of Health how good that experience can be and use to scale up. Working in terms of adapting materials for different groups of adolescents in terms of the platform we have designed. We need to relaunch and launch new messages and videos, and that's something that offers opportunities to work with. Different ways. So one is working in a particular topic, creating a group to work for some time to develop and test along with our students, or prepare something before the arrival to Ecuador where something can be implemented.
Thank you so much. If there are students that reach out with interest, I would be thrilled to connect them with you.
Yes, please. Thank you very much.
Thank you. So I just want to take this opportunity to thank you for speaking to the students about the really inspiring work you're doing at USFQ and in Quito. Every time I hear you speak about these projects, the passion for public health and for medical education and working with communities is infectious. And I wish I were a young medical student. I would really want to work with you. I think it's very exciting and the work you're doing. So thank you so much for speaking with students today.
Thank you. Thank you very much. And everybody, bienvenidos aquí to Ecuador. Spanish is the language, the official language for your experience in Ecuador. So if you want to improve your Spanish, learn about global health, or implement any interesting experience, we will be more than happy to host your rotation and make that a very wonderful experience. Thank you for your time and attention. Thank you, Tracy, for making this opportunity